Hi, welcome to everybody. So, first of all, we're just going to have a little look at the aims and objectives of today's session. So, we're hoping that today's session will provide you with some knowledge and understanding of the principles of safe and effective care. Quite often, when we think about that, it's often related to the care delivered by healthcare support workers with patients, but we can all be involved in the patient's journey in some way at some stage. So that involves each and every person in this call today. We'll also be getting you to have a little bit of a think about your codes of conduct and reflect on these in relation to your role in the handling, storage, and documentation of records. Hopefully, the stories that we're going to share today will also get you thinking about the role that you all play in the patient's journey.
Thank you, Karen. So, Karen alluded to the codes of conduct. The reason why we want to talk about our codes and standards is because it's important when it comes to the delivery of care, whether we work with patients or work in porting services, estates, admin and business. Our standards provides a means of ensuring that all new support workers have knowledge and skills needed to contribute to carrying out safe, effective, and person-centered care. The standards, as you can see on the very first image there, that is the standards workbook. This becomes the foundation of our codes of conduct throughout our careers. So we are only sharing the Healthcare Support Worker Code of Conducts, and I know it says Healthcare Support Worker Code of Conduct, but it does apply to the workforce. These are currently being reviewed and getting updated. So if you want to be in the know of new things that are coming, please sign up to the NES Healthcare Support Worker newsletter, and it's a great form of communication of finding great resources and anything that NES are currently doing. Um, I know that we've only shared the healthcare support worker code, but there are obviously the nursing and midwifery codes of conduct, and I'm aware that there are nurses and midwives and managers that are on the call that might support workers in their workplace. So it might give you a little bit of an understanding of what these codes look like. So the Codes of Conduct was introduced by the Scottish Government in recognition of the important role that we play in the patient's experience and the services that we deliver in NHS Scotland. It's a national code, so that applies to all support workers in NHS Scotland. The codes ensure that we all work to the same standard when it comes to carrying out safe and effective care. I'll pass you over to Karen so you can explore the codes a little bit more with Karen.
What I'd like us to do now is reflect on these in relation to your role. So, if you've got a pen and paper, hopefully handy, or perhaps you can take a wee photograph of the screen, I'd like you just to have a look at each of these codes, take a couple of minutes to do that, and then reflect on how they apply to the role that you play in the handling, storage, and documentation of records. Just take a couple of minutes to do that. What hits home to you most about the codes? So, thinking about accountability, for example, we're all accountable for the actions that we take and the duties that we carry out day to day. And that applies to all of us as support workers. Looking at data protection, what we'll do is we'll move on to the next slide. So, again, yeah, just having a wee look at that and just taking some time again to reflect on how that resonates with you and your role in relation to documentation and record keeping.
Thank you, Karen. So I think we're going to go over the next few slides about the good principles of record keeping and maybe the poor principles of record keeping. So focusing on the good principles of record keeping and documentation. A word that you've probably often heard over the past week and throughout your careers is we need to ensure that it is person centered. And what we mean by this is making sure that it's about doing with our patients and not doing to our patients. So the care episode that we've maybe carried out with our patient, we have to ensure that we are accurately reflecting the patient's wishes within that documentation. So it's not a case of just bed bath to patient, but what did you do with that patient? Was there consent involved? Did the patients want to use their own products? Did they have their own clothes? And what the assistance was required within that? I'm sure many of us have probably come across some poor records, but Karen will go into a bit more detail about that. So again, we want to ensure that it provides a mean of communication across the multidisciplinary team. A lot of you had said in the chat and had alluded to this being one. So absolutely, this is a key principle. It is a means of communication across the multidisciplinary team. So we need to ensure that what we record within the notes is the most up-to-date information and it is recorded as soon as possible. Communication's so important across the MDT team, multidisciplinary team. It ensures effective teamwork, collaboration of our colleagues to have better outcomes for patient care. So no matter if you work in a ward, work in a GP practice, or you work within admin and business, we have to make sure that all our records are up to date and accurate. So getting the right information is also relevant and absolutely necessary. So we have to ensure that obviously the information that we receive has the correct information on it. It is the correct patient. For instance, if you're a receptionist in an outpatient's appointment and you have a patient come up to you for their appointment, we've got to make sure that we have the right patient for the right appointment for the right area. So getting the right information is key and sometimes can often be overlooked. Storing and transporting information to the right place. Again, some of us had already said within the chat that it has to be locked in secure places. So if it is paper copy of records, ensuring that we've locked them in filing cabinets and they're in a locked room or office. If we use electronic documentations, making sure that we are logging out of computers and that no one else has access to your login details. Um, Transporting information to the right place. For instance, if you're a porter and you've come to collect a patient to go for a scan, and making sure that you've got the right patient and that when you're transporting that information or the patient's notes, that again these are secured in a sealable bag or in a safe place. So the sharing and using of information at the right time. Again, a lot of you had said some really good answers in the chat there. So personal and confidential information often used to improve quality of healthcare services. So collecting and analysing data, some of you might do in your jobs, got to ensure that the information that is being used doesn't identify patients' information and only the relevant information that is being shared. So these are just some of the good principles of record keeping and keeping in mind. And I noticed someone else in the chat said to stay away from abbreviations and your assumptions as well. So when it comes to delivering care to a patient, absolutely trying not to abbreviate what you're saying within those notes, electronic or paper copy, and again being free from assumptions.
Thanks, Gemma. So naturally, the poor principles of record keeping and documentation, that's not going to be a person-centred approach. If you're not following the good principles, it's not going to be person-centred. It could compromise patient care if you've not got the right information or if the right information isn't shared appropriately. It could also result in a data breach. It's also not going to comply with your codes of conduct that was reflected on already. And it's also the law to make sure that we safeguard patients, and that also includes their information, as Jem has already reflected on. So what I want to do is just give you a wee second to think about the poor principles, and I'm going to share a little story with you, and this is a true account of something that happened. When I'm sharing that story, I want you to have a little bit of think about your codes of conduct and how they might relate to this situation. So there was a patient attended a clinic for their appointment one day. They were presented with the consultant and a healthcare support worker at the beginning of their appointment. The appointment began, unfortunately, with the consultant sharing that they could not locate their records. These were written records, they weren't electronic. So naturally, that was a little bit concerning for the patient. But they were being understanding. These things happen. They shouldn't happen, but sometimes they do. The consultant seemed quite concerned because they didn't have the patient's records to be able to take a history of previous symptoms, etc., to create a clear picture of the patient's condition. Understandably, the patient was a little bit upset, was a bit concerned about who had access to the patient's records. The information contained within those records once was sensitive to them, but the consultant, like I said, was a wee bit more concerned with gaining a previous history of symptoms up to that point. So the patient did begin to share that information. They were quite tired. It was a tiring process for them, and it was a bit upsetting having to recall everything and repeat everything that had happened for the couple of years previous. It was really difficult to recall all that information. The healthcare support worker at this point, they had been taking notes on behalf of the consultant as the consultant was asking questions. At one point, the patient became a little bit upset. The consultant didn't seem to recognise this, but the healthcare support worker did. So at that point, she interjected and suggested that perhaps the patient will like to take a little minute just to compose themselves, just to calm down, take a breath, and just really just get a wee minute to get back into a better space. They were obviously finding this quite distressing. In the back of their mind, probably still worrying about, well, where actually are my notes and what's actually happened to them, who's got access to them. So the patient took a couple of minutes to do this. And while the patient was doing this, the healthcare support worker had a little bit of a conversation with the consultant about, perhaps given the limited time that we've got left today, quite a bit of the appointment time had been taken up with trying to gain the knowledge of previous symptoms, etc. Perhaps they could move on, carry out the examination that the patient originally came in for, and then maybe gain more information at a later appointment date, or once the examination was finished, if there was time allowing for that, because the patient was quite naturally distressed with regards to the whole experience. So that was how they proceeded with the appointment. The patient left, as I said, still a little bit distressed, a little bit upset at the fact that they didn't know where the records were, but they had their examination. The consultant had the information that they needed at that point. What I want you to have a wee bit of a think about is how could things have been done differently? Could there have been a different approach to that situation? Could things have been done differently that would have allowed the patient not to maybe get quite so upset and for there to be a better outcome? If you think about your codes of conduct in that situation and how they would relate to that. So I can see a few comments in the chat there. Somebody said that it's a good example of using non-verbal communication to see the change in the patient. Absolutely. Somebody else has popped a comment in about better organisation skills and prep work. There's been some comments shared about sensitivity, offering the patient reassurance. Yeah, absolutely. Allowing the patient some time to process the loss of their notes and what that means to them. Yeah, and somebody quite interestingly has popped a wee note in there about checking the clinical portal to find out when the last appointment was, because that might obviously help locate the records from there. So where were the records last held? Yeah, so I mean, interestingly, yeah, there's quite a lot of comments in there around sensitivity towards the patient, enabling them some time to process the fact that their records are missing, the awareness of the patient's needs, breach of confidentiality due to loss of the records. Somebody's popped in there. They could have had their examination initially, and new notes could have been gathered later based on that examination.
Being aware of the needs of the patient was an electronic copy of the records, could have an examination and followed by a follow-up appointment. Yeah, that's a good point there as well. What we'll do is we're going to be sharing with you some stories that we have collected over the past couple of months from support workers around Tayside and what their roles are in record keeping. So the first story I'd like to share with you is from the portering services. So again, me and Karen had great fun actually finding out what people's roles were when it came to handling information, storing information, or recording information into patients' records. So the portering services I spoke to, again, keeping in mind that I know that there are many jobs within the porterings. I spoke to Susan and Alice who work in portering but also are receptionists. They were telling me that they sort out and deliver mail around the hospitals for employees. So, again, confidential information, making sure that all this information goes to the right departments, to the right people. And sometimes when they're delivering mail, there's a required signature for maybe confidential information or sensitive information. They also record any sort of outgoing mail that employees within NHS send externally as well. When they've have visitors coming to the hospital site, they log this information into paper records and they are kept on file for up to a year, and they are in secure cabinets. Sometimes people who are visiting the hospital site may be attending for interviews. So again, confidential information is exchanged between the two people. So they also keep a record of this in locked cabinets. So that was just a little snippet of sort of the portering side of things. But again, I am aware that there are many people work in different roles within portering services. So Karen was going to talk about the admin assistants. So she'll pop that information that she's received within the chat. So I was speaking to the catering services up at Nine Wells. I spoke to a lovely person called Christine. She is an assistant catering manager. Um, and some of the information that she handles in her role is so within the hospital settings, patients' meal menus will be sent along to the ward areas, and the people in the ward will fill out the patient's meal menus. Once they've done that and have inputted all that information, the meal menus come back to the kitchen, and this is where they input it on an electronic system. Um, the kitchens sort out the meals and organise what patients' meals are going where. This will be received by the ward area, and obviously the meals would be given out to the patients. After the meal times are finished, some of the menus may be left on the trolley when it goes back to the kitchens. And because obviously this states the patient's names on these menus and it has their NHS identification symbol, they have to destroy this within the blue confidential waste bags. Um, as an assistant catering manager, Christine also deals with employees' files, and she was saying to me that these are locked in a filing cabinet inside a locked office. Um, she also handles people's information when it comes to job train and doing interviews. And sometimes she has to print some of this information off. And again, this would be destroyed after any sort of information is not required, or if they do take on people, then they would store these records in the same filing cabinet. Um, Sometimes they'll have inspections of deliveries, so they have invoices and record any deliveries that get sent to the hospital, so food items. What they would do is they record the temperatures and do control checks to ensure that these food items are up to standard. And again, all this information is stored for up to a year and disposed of after. So the next story that I collated from some of the support workforce was a support worker called Katie who works within the labs at Nine Wells. And in Katie's role, she sorts out and prepares patient samples that are received from GP practices, ward areas, community hospitals. Um, Once she receives these samples from the area, she cross-checks the patient's identification. So ensuring that the information that she has relates to the information that has been received. She inputs a lot of this information onto electronic databases, so they very rarely keep paper copies. It's mostly electronic databases that she deals with. She listed all these electronic databases to me, and I kind of got lost in all these databases that they actually use to store information. Sometimes they'll have an outstanding samples list that's printed off, and they have to go through this list. And again, this list is locked in folders within locked labs so that no one else can gain access to this. Um, Sometimes samples within the labs have to be sent to external hospitals because maybe that hospital doesn't have the right equipment to be able to process that sample. So sometimes samples have to get sent down to London hospitals or other hospitals across the country. So when it comes to this, she has to make sure that the information that she has for the patient is the right information and that it's going to the right place. Again, this is all recorded within an electronic database. Um, the labs will also receive stock of equipment that's been ordered, and this is also recorded and kept in locked files. So the story that I collected was from an AHP support worker, a lovely AHP support worker I spoke with the other day. Her name's Isabel. She is from speech and language, so she's an assistant practitioner in speech and language, and she predominantly works with children. So they've recently have gone over to electronic records, but before this, they would have it all sort of paper copy. And because Isabel goes to varying different places, schools, different hospitals, they would have to store the paper copy in sealable lockable bags because obviously they are out with NHS buildings and they are going to different areas. So obviously she no longer has to do that because it is all electronic, and she's finding it quite easy to adapt to the electronic ways of records. What Isabel will be recording mostly is sort of the session plans that she has received from the speech therapist. So when she comes to see the patient, she documents the contact she's had with that child and records any of the targets that the child's met. She'll also record any plans for the sort of following up weeks and ensure that this record is up to date and accurate. Um, After her sessions with the children, she'll update the parents via phone call or she'll put a message in the child's bag to take home. And again, this is a confidential phone call, so she'll ask questions to make sure that the person at the other end of the phone is who they say they are. Um, she describes to me how important it is to document, as this is used as a communication tool across a multidisciplinary team. So, a child might come into varying other services, so it's important for what Isabel records is correct, so that other people from other professions have an understanding of what's going on. I'll just pass you over to Karen because I think she might have gained her voice back.
Apologies for that, everybody, and apologies to you, to Gemma, for leaving you in the lurch there. So yes, I spoke to a couple of healthcare support workers who are trainee assistant practitioners over at PRI, Kelsey and Ailey. They are involved in documentation and record keeping in a variety of ways. So they have to keep patient records, and at the moment those are paper copies, not electronically. So naturally, they need to be quite careful about who has access to that because it is paper. They are stored securely in the trolleys for each bay. They also they use must screening tools, which help identify patients at risk of malnutrition or obesity. They do intentional care rounds, which monitors patients' personal needs, for example, positioning, any pain that relief that they require. They are involved in referrals and discharges. The recording on fluid charts of patients' intake and output. In terms of storage, as already mentioned, they use trolleys for the notes. They don't currently document patient records electronically, but they do have access to some systems such as Acora, which is a doctor's note system, and that really helps them provide and contribute to an accurate account of the patient's journey so they can really see what's going on. In terms of confidentiality, as many of you have already popped in the chat earlier on, only exchanging information with the relevant staff as and when necessary, and being really mindful of sharing patient information with families and visitors. For example, somebody calling the ward area to ask for a wee bit of an update, they need to make sure that they check the notes and that they've got permission to be able to to share that information. So I hope that just gives you a wee bit of an overview of what healthcare support workers do. There is a lot more involved, but that's all we've time to share today.
But we're very aware that there's so much varying roles out there across NHS Scotland and what people do when it comes to recording documents and handling that information as well. So, what we'd also like to do before going on is there's some really useful resources on the TURAS site. It says COVID-19 resources, it's record keeping resource, but it's a very good resource. Again, this is getting reviewed, but I've used it in many sessions previously with support workers.
Thank you, Gemma. No, you've done a wonderful job. Gemma, once again, my apologies for earlier. It's been absolutely lovely to have you all on the call today, and I hope that you have managed to take something away from today. Gemma and I are available via email, and you'll just find us by searching our names on the email system. If you have any other questions after today, we're more than happy to help support where we can.